Hello everybody, welcome back to my channel Preventive and Social Medicine. My name is Dr. Mehta, first year PG resident in Community Medicine Department. In the previous video, we have discussed about the symptomatic management of monkeypox disease patient. In this video, we will discuss briefly about the isolation guidelines. So in case of monkeypox disease, we have to consider why, how and how long a patient has to be isolated. So why are we isolating a patient of monkeypox diseases? To minimize the risk of transmission from person to person, and how with the use of physical barriers and keeping a distance of at least 1 meter at all times, and how long until a new layer of healthy skin has formed. So until the patient is considered to be recovered, we have to isolate the patients. According to guidelines released by Ministry of Health and Family Welfare in India, all the patients affected with monkeypox virus should be isolated in hospital. So we will know for hospital admission, we have to transfer the patient via ambulance to reduce the risk of transmission. So prior information to be given to the hospital of the admission or transfer of the patient. Personnel accompanying the patient, including ambulance driver, should wear PPE. Lesions should be covered with clothing or linen available. Linen should be sent in a closed bag after properly labeling it to laundry for disinfection. Ambulance should be disinfected with 1% hypochlorite solution, mask and contaminated material to be discarded in yellow bag, which in turn will be sent to incineration. Then isolation in a basic health facility. It consists of isolation room, antechamber and a washroom dedicated to that room. So patients should be separated from one another with the help of screens. This antechamber should be used for dunning and duffing of the PPE by the healthcare workers. So this news article dated 29 May from दैनिक भास्कर. अब मंकी पॉक्स का खौफ एमबी के स्वाइन फ्लू भवन में बनाया आइसोलेशन वार्ड. 28 बेड वाज संसाधन तैयार. So as I am pursuing MD from Udaipur, I have shared this article. Similarly, all state and district governments have prepared isolation wards for the management of monkeypox disease patients. Indian government and other countries with imported monkeypox cases have not released any guidelines regarding home isolation of the patients of monkeypox disease. As it is an endemic disease in African countries, WHO has released guidelines of home isolation for them. So infection prevention and control, care at home. So we have to follow the advice of healthcare worker, provide a separate area for care, minimize the contact with the patient and the healthy persons in the house. So they have to use protection like mask and gloves to care for the patient, to clean and wash at home, to wash the lining with care. So the lining shouldn't be shaked at any point of time. It will release the virus particles into the air, which will result in transmission of the virus to healthy individuals. So, and it should be washed in the closed bags or closed bins. So disinfect the surfaces and floors. Wash hands frequently. So we have to follow 5 moments of hand hygiene. So these are the 5 moments of hand hygiene to be followed by healthcare workers for caring for the patient in the isolation ward. So before touching the patient, after touching the patient, before clean or aseptic procedure, after risk of exposure to body fluids, after touching the patient's surroundings. So all the healthcare workers should wear PPE before collecting the samples, while handling the samples in laboratory, while taking care of patient in isolation ward, and those handling biomedical waste, and the personal handling dead bodies of monkeypox disease patient. So let us see stepwise procedure of dunning of PPE. So in step 1, we have to gather the necessary PPE. In step 2, we have to first put on the gown. Step 3 is put on the medical mask. Then put on the eye protection. Step 5 is last step is put on gloves over cuffs. So duffing of the PPE is as important as dunning and should be done carefully to prevent transmission of infection. So in step 1, first we have to remove the gloves and gown. Step 2, perform hand hygiene. Then in step 3, we will remove the goggles from behind or side. In step 4, remove the mask from behind and perform the hand hygiene. So now let us see injection and medication safety to be followed by healthcare workers. So 7 steps for safe injection. A clean workplace has to be maintained. Clean hands and wear gloves. Use sterile injection equipment. Use each one once for one patient. Properly disinfect skin before injection. Ensure sharps disposal. Ensure proper waste management. So in the next slide, we will see the biomedical waste management of the biomedical waste management. So solid linen to be sent in a closed bag to the laundry for autoclaving after properly labeling it, so that the person doing the disinfection will also wear PPE by looking at the details labeled. So person handling soil linen should wear appropriate PPE. Contaminated material shouldn't be disposed in open landfills. Surgical mask, contaminated material should be disposed in yellow bag. Waste in the yellow bag should be treated by incineration. In some countries, like these yellow bags are kept in the closed cabins to prevent the risk of transmission. So we will discuss what is outbreak. When it is considered as outbreak, even one case of monkeypox is considered as an outbreak. In Africa, monkeypox requires immediate reporting. Monkeypox is notifiable to WHO where unusual, unexpected, or may lead to international spread. So, why are we discussing monkeypox now? Is like it is an endemic disease in African countries, but it has spread to almost 40 countries. So it has a potential to become the next pandemic. So first case was reported in May 7, 2022 by United Kingdom Health Security Agency in traveler returning from Nigeria. So more than 2,681 confirmed cases reported across 40 countries by 19 June 2022, with the highest number of cases in Spain, followed by UK and Germany. So what are the steps we have to take? We suspect a monkeypox outbreak. First, we have to report to the authorities. Then we have to confirm the outbreak. Then convene a multidisciplinary team, which is RRT in India, the Rapid Response Team. So develop a case definition according to the country guidelines. So identify all the cases, describe and analyze data, conduct special studies, and communicate the results. So this is the investigation form released by Nigeria government for case reporting, where all the details of the patient's health condition and epidemiological links are collected. So this form is released by NIV, National Institute of Virology, Pune, where we have to fill all the details of the patient. This form is similar to that we have, which we have used in COVID sample collection, and to be sent along with the samples to the laboratory. So we have to next step. So we have first in the first step we have to report the authorities. In the next step we have to confirm the outbreak. How will we confirm the outbreak? Like verify signs and symptoms. First we have to verify the signs and symptoms. Then collecting the samples for lab testing. Then interviewing the index case, the first case, like about exposure, occupation, bushmeat, any consumption of bushmeat, and any contact with wild rodents, any contact with the ill persons, or any travel history and clinical history, and this vaccination history. So we have to convene a multidisciplinary team. So team members should include experts in field epidemiology, clinical assessment, biological specimen collection, infection prevention and control, risk communication and community engagement, animal health specialists. In India, rapid response teams are formed through IDSP, Integrated Disease Surveillance Program, which was like that, which was formed similar to COVID management. Let us quickly go through the case definitions provided by WHO and Indian government. So this definition is given by WHO. What is suspected case? Suspected case is an acute illness with fever more than 38.3 degrees centigrade, with intense headache, lymphadenopathy, back pain, myalgia, and intense asthenia, followed 1 to 3 days later, were progressively developing rash, often beginning on the face and spreading elsewhere on the body, including palms and soles of the feet. So, this is the definition of the suspected case. Then, probable case of monkeypox, a case that meets the suspected case definition and is not yet laboratory confirmed and has an epidemiological link to a confirmed or probable case. So, confirmed case of monkeypox. A clinically compatible case that is laboratory confirmed is considered to be confirmed case of monkeypox as per WHO guidelines. Let us see the Indian guidelines. So, suspected case is a person of any age having history of travel to affected countries within last 21 days, presenting with an unexplained acute rash and one or more of the following symptoms like swollen lymph nodes, fever, headache, body aches, profound weakness. Next, we will see the probable case of monkeypox. A person meeting for the case definition for a suspected case, clinically compatible illness, and has an epidemiological link. Face-to-face exposure, like including healthcare workers without an appropriate PPE, direct physical contact with the skin or skin lesions, including sexual contact, contact with contaminated materials such as clothing, bedding, or utensils. So, let us see the confirmed case of monkeypox. A case which is laboratory confirmed for monkeypox virus by detection of unique sequences of viral DNA by PCR or by sequencing method. Considered to be the confirmed case of monkeypox. So, in the next video, we will discuss about the surveillance and vaccine of monkeypox disease. Thank you.